This is 2024. We are living in an incredibly exciting time. We have the power to really read this DNA blueprint of life. And with this technology, we're able to use it like a crystal ball to look into the future with a very high accuracy. And this transformative work is happening right here in Harry Perkins Institute in Western Australia. It's such a pleasure, Professor Morahan, to be here today and learning more about the breakthrough you've just had.
Well, thank you, yes. We've made a breakthrough in the way we can analyse genetic data so that we can take a simple DNA sample and then predict their lifetime risk of having bad disease outcomes like having a heart attack or a stroke.
So you're talking about predicting before actually the disease happens in a person.
We could do this many years or even decades before any of the warning signs are present. Why this is important is that those people will be able to change their lifestyle so they can reduce their risk, and the doctors will get earlier warnings and so they can provide better management and earlier to help those people.
Wow, this is incredibly exciting because that is exactly what I believe that the precision medicine is going to take us.
People have been talking about precision medicine for a long time, but for the common diseases that cause such big problems in society, we're not able to do that. We are able to do it now with our technology. Well, the reason why our tests are so important is that currently doctors can't tell which of their patients are most likely to have a heart attack or stroke. They can't tell which of their patients with diabetes are most likely to get diabetes complications, and they can't predict accurately which of their patients who have cancer are more likely to die of cancer. So our tests are much more accurate than most of the medical tests that are currently in use. We can apply that test to your 10-year-old, for example, so that that 10-year-old is able to know what their lifetime risk is and to take steps to eliminate the bad factors in their lifestyle and accentuate the good factors.
When do we see this in the hands of the clinicians?
Well, we'd like it to be as soon as possible, obviously, but in order to make this test available to people to help save people's lives, it costs about $1 million to get the government approval. So we need that investment.
At this moment, how much it is costing Australia when we're talking about the diseases you're talking about?
Well, heart disease and stroke cost the Australian National Health Budget about $12 billion a year.
We're all hearing this word a lot these days, personalised medicine. Is this exactly what it looks like?
This is exactly what it looks like for the common diseases. Up until now, personalised medicine has only been used for rarer diseases or for simple drug interactions. But now, our technology allows us to use personalised medicine for the common diseases that cause such big problems in our society.
What we have seen today is an incredible example of how we can transform the entire healthcare system. This is why, as a nation, we must get behind these innovations and innovators like Professor Grant Morahan.